Today we're going to discuss a little bit about Latino health. And as you know, in the United States, we're close to 60 million Latinos. And the incidence and prevalence of diabetes in this community is very high. Even today, in 2015, the preferred language at home is Spanish. And we are called Hispanics, Latinos. We understand, but we prefer to be called Latinos rather than Hispanics. And we have the help of a company, Janssen, that helped us develop a tool to facilitate the interaction between physicians and patients and have the patients understand better diabetes, learn more about diabetes, and engage better with the physician. Well, I want to tell you that last year, one of my good friends from NIH presented data. In the old days in the US, minorities, used to have more diabetes. Poor people used to have more diabetes. Those that finished college used to have less diabetes. But that imbalance is coming to a balance. So everybody in the United States has a very high risk for diabetes. One of the biggest problems in our community is the lack of health education, in the Latino community as well as in the general community. Second, our eating habits have deteriorated. Everybody thinks that Latinos eat at home every day and they bake the tortillas and the beans. But to be honest with you, in most of the families now, not only the husband or the father works, but the mother, the spouse, works as well. And after a full day of working, picking up the kids at the school, some of them actually find inexpensive places to eat, but they eat what we call junk food. And that is deleterious to the health of anybody that eats that on a regular basis. The approach is different because the biggest barrier is language. The second biggest barrier is cultural sensitivity. We have different ways of doing things. We like to bring more family members to the doctor's visit. And sometimes the doctor says, I only want to see the patient, because you also need to be in their side. They have a few minutes per patient. They need to see so many patients in today's environment to break even. And Latinos want to have family members for support. And that's very important. The second is, in places, you need to have somebody to translate. And doctors need to learn a few little things. A few words in Spanish helps. Seeing you as a doctor at your eyes may not be what they want, but the doctor seeing you instead of the computer is very important. Well, I think this tool that we have will make things much easier for the doctor, will expedite some of the visits, and is cultural sensitive. And I'm very pleased that it is available, and hopefully doctors will use it. Look at Boston. The guy that took me from the airport to the hotel is a Dominican. The dispatcher is from Mexico. And here at the hotel and the convention center, there are many people of Latino origin working. And I saw many from Dominican Republic today. So you are absolutely right. There's not anymore the Southwest that has Latinos. Obviously we have a big pocket of people in Miami that everybody thinks are only Cubans, but I tell you, it's not only Cubans anymore. It's also people from Mexico. And we're not going to stop this because we have a huge border with Mexico. And to be honest with you, I think we need some people from Latin America for some work that we Americans don't want to do, or some Americans don't want to do. So the tool will be important, and the newcomers, the new immigrants, for sure, lack the English language. Many may have gone back to Mexico and see the doctor there because they're afraid to come to visit here. And one of the reasons is we don't have enough Latinos like me that speak Spanish seeing patients. And that's one of the things I want to encourage Latino people to send the kids to medical school and nursing school so we can bridge that gap.